Hello everyone. Today we are going to talk about dental anesthesia. Certainly you suffered from caries problem and pain in your teeth one day, and therefore you had to visit the dentist, who in turn removed the caries and placed a dental filling on your teeth without feeling any pain. Have you asked yourself how did that happen? Well, the dentist numbed the nerve supplying an affected area and you can no longer feel any pain. In this video, we'll talk about everything related to dental anesthesia, how it is done, the reason for resorting to it, and how long the anesthesia lasts. Our role today is to answer most of your questions regarding dental anesthesia. Today we have Dr. Baik, who is a leading doctor at Anesthesia Dental Hospital. He's going to discuss with us everything about dental anesthesia from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Baik. How are you?
Hello, I'm Sang-yoon Baik.
Can you introduce yourself to our audience?
I'm Director Sang-yoon Baik, and I am in charge of treatment at Anesthesia Dental Hospital. Nice to meet you.
So for our first question, what are the types and difference in dental anesthetic?
Dentists usually use local anesthesia. With local anesthesia, only the area being treated is anaesthetized. Most treatments are performed under local anesthesia. Sedation, which I will explain today, is a concept of general anesthesia, meaning the whole body is anaesthetized. I will explain the details in the following questions.
So, what types of sedation or sleep dentistry are there in dentistry?
Sedation is often talked about, but sedation is not an official medical term. In general anesthesia is largely conscious anesthesia, an anesthetic method called conscious sedation. And then there's deep sedation, a completely unconscious deep sleep. So it can be divided into these two categories. General anesthesia, a deep sleep, with consciousness, is what we usually see in medical dramas, and this is the deepest one of all. But are sedations in general anesthesia the same? No. The biggest difference between sedation and general anesthesia is that you can breathe on your own. Usually when we perform surgery, the patient does not breathe on their own, but we will operate with a ventilator. However, the sedation performed at the dentist is different from general anesthesia, in that the patient can breathe on their own, even if they're sleeping. And as I said earlier, in the category of sedation, there is conscious anesthesia and unconscious anesthesia. That is chosen depending on the situation, how sensitive the patient is to fear. So there are things that are done in a light sleepy state or a conscious state. And being conscious is enough to answer, "Are you okay?" during the treatment. But they would only be a little bit sleepy so they wouldn't feel fear. But deep sedation is when they are completely unconscious so they wouldn't reply, but still able to breathe on their own. So it can be divided like such.
So who is a good candidate for sedation dentistry?
Sedation can be considered to be possible in almost all patients who can do general anesthesia. However, I will tell you that it is a mild sedation among sedation anesthesia. The method of conscious light sedation anesthesia is oral administration, which usually involves taking one pill and taking a drug that makes you feel sleepy. The second is called gas. So there is a sleepy gas called N2O. It's called small gas or happy gas because they make you laugh. There is a light sedation performed in a state of inhaling such gas and becoming a little sleepy. Since this method is commonly used, there are a few patients who cannot adapt to it. However, the deeper it goes in, the more the drug is injected through the intravenous injection, and the patient falls asleep. At that time, the patient must go through some tests. Broadly speaking, those who have a large lesion in the heart or kidney, or who have had a major surgery in the past, may need additional tests.
So, can the patient feel anything during the treatment?
Among sedation, conscious sedation is when the patient is conscious, so when it becomes very painful, even during dental treatment, for example. Local anesthesia is applied to the area even if sedation is already performed. We usually fear the most at that moment when the needle goes in, right? That's why before injecting with a needle, they put you in a sleepy state, so that you don't feel it when injected. However, you may feel a slight tingling sensation at that moment. However, there is absolutely no sensation at all in deep sedation, in the state of being fully asleep.
So is this sleep dentistry safe for everyone?
Most of the sedative anesthesia used in dentistry is performed in a safe condition because patient safety is the most important screening condition. It is believed that the lighter the procedure, the less side effects. Among deep sedation, there is a slight difference in the medicines that are usually used. Midazolam, an intravenous drug that is commonly used for complete sleep, is always monitored while the patient is undergoing treatment. There are drugs called antagonists that can wake the patient right away if we notice even a slight bit of an issue in the patient's condition. That's why there is a prescription that prevents the patient from getting into a serious situation, because even if they fall asleep, they can wake up immediately when the drug is used. If the patient wants a deeper sleep, then they would get midazolam, either because their fear is too severe or they don't want to receive any sensation during the treatment. Then propofol, which you may have heard of, or other medicines that are used, which is a little different from midazolam. The biggest problem when using such drugs is that the deeper it goes in, the more you have to breathe, but your breathing function may decrease. Therefore, it is most important to always monitor whether you are breathing well and whether your own oxygen is being supplied well. Light sedation anesthesia is something that the dentist can control while performing the procedure in general dentistry. However, if you want deep sedation, sleep anesthesia, it is better to get help from an anesthesiologist, like our hospital. It can be said that it is a safer way for the anesthesiologist to continuously monitor the condition and for the surgeon to focus on treatment.
So is it possible for all dentists to perform sedation anesthesia on every patient?
As I mentioned briefly earlier, among all dental anesthesia, some dentistries do it according to the decision of the director and some do not. But light sedation can be done safely even under the supervision of a dentist. In particular, in pediatric dentistry, and dentistry that treats children, a type of sedation that has little gas or side effects is used very routinely. You can do that, but if the patient has a dental phobia or something like that and wants to sleep completely, there must be a variety of equipment to keep monitoring the patient during treatment. If you want such treatment, it is safer to choose a hospital equipped with such equipment and a hospital that can collaborate with the head of anesthesia department.
So for our last question, is there any side effects on sedation?
In general, after sleeping under anesthesia, the patient would usually wake up after about an hour or an hour and a half. And when they wake up, they can get a little headache at first. But general things like this get better after a while. In particular, hospitals such as our hospital, where deep sedation is performed in which you sleep completely, have recovery rooms. After the treatment is finished, and after waking up from the sedative anesthesia, if you rest in the recovery room for about an hour before you leave, most of the mild pain and headaches can all go away. However, it is important to remember that even after 1 or 2 hours of recovery, the patient may remain drowsy to some extent when they return home. That is why we strongly advise you to take enough time to recover before you drive, handle delicate machines, etc. We also always ask our patients to be accompanied by their guardian, or if possible, to use a taxi or public transportation rather than driving on their own. I think that's the most important part.
네, 알겠습니다. 감사합니다.
감사합니다.
Thank you so much for your time.
Thank you.
So today we learned many things about dental anesthesia, and the doctor explained in details everything related to the types of anesthesia. Thank you for joining us once again today at CloudHospital TV. If you have any questions and comments, please leave them below and we'll respond to you as soon as we can.